All right, good afternoon, everyone. Thank you for joining the Foundation for a Healthy Kentucky's Health for a Change webinar, Crushing Farmer Suicide Through Cultural Respect and Humility. I'm Allie Wells, the Communications Associate at the Foundation. Before we get started, just a little bit of housekeeping. We've enabled the live transcript feature on this webinar. You can control whether you see the closed captioning by selecting live transcript on the bottom of your screen. We also invite any questions you may have, just type them in the chat box and we'll address them during the Q&A portion of this program. First, just a little bit about us. The Foundation for a Healthy Kentucky is a nonpartisan, nonprofit organization focused on healthcare access, tobacco use reduction, obesity and diabetes mitigation and prevention, and child health, specifically preventing and mitigating adverse childhood experiences. Much of what we do is in the policy realm, whether on the state level, local level, or even school or organizational level. We are here today to talk about farmers. Farming can be stressful and challenging. Farmers face several stressors, including the weather, the market, and financial challenges. Now, these high levels of stress contribute to high rates of suicide among the farming community. As an occupational group, farmers have one of the highest rates of suicide. And unfortunately, mental health providers are limited in rural areas where farmers live. So what can be done? That's what our presenters today are going to be talking about. We are joined by Catherine Mallon, the director of the South Central Kentucky Area Health Education Center, and Professor Don Garrett Wright of the WKU School of Nursing and Allied Health. And with that, I am going to turn things over to them.
Well, good afternoon. Catherine, if you want to go ahead and put our slides up for us. We want to start out, obviously, by thanking the Foundation for this opportunity to talk about this very important issue and what can be done. We hope to mitigate suicide risk in farmers and to improve their overall mental health. So the title of our presentation today is Preventing Farmer Suicide Through Cultural Respect and Humility. So we'll be talking a little bit about that. The project team does include Catherine and myself, and then also Dr. Susan Jones, who is Professor Emerita from the School of Nursing and Allied Health at WKU. And she is our principal investigator on our project. And very important, we do want to give credit for the funding that we received for this project. The funding was provided through the Kentucky legislature through a general fund appropriation that occurred in 2020 and 21 that was to support the overall project of Kentucky Rural Mental Health and Suicide Prevention Pilot Program. What has developed out of that, if you'll see the logo on the bottom of all of our slides, is an overarching program called Raising Hope that we hope you will hear about throughout Kentucky for many years to come. And it really is targeting farming and agricultural populations and hoping to improve mental health. There's a lot of focus on physical health, but not as much on mental health. We are just one arm of this project at WKU, and we call our arm the Crushing Farmer Suicide aspect, but we are also joined in this project by several entities, so I wanted to mention a few of them. Kentucky Department of Agriculture, the Department of Behavioral Health, Developmental and Intellectual Disabilities, and also the Southeast Center for Agriculture through the University of Kentucky, and then also working with the School of Nursing and some of the public health people at the University of Louisville. So it's a large collaborative effort between all of us to hopefully improve mental health for our farming and agricultural communities. So what we hope to accomplish today, and again, as Allie said, if you have questions, please put those in the chat, and Allie and Ashley will help us get those questions at the end, and we're glad to spend some time during Q&A. But we hope to accomplish today discussing reasons why farmers have high stress levels. That may not be something that some of you are familiar with, and so we want to talk through that. And then we want to look at a way to approach farmers using cultural humility rather than cultural competence, which is kind of more commonly discussed. So we want to talk about cultural humility and what that is, and how we can use it in working with farmers. And we'd love to tell you more about our 1-hour continuing education project that we developed for healthcare providers and healthcare professionals so that they are more equipped to help our farming populations with stress and mental health issues and hopefully mitigate that suicide risk. So the purpose again is just to discuss our project that we call Crushing Farmer Suicide, and crushing, we use that acronym to stand for cultural respect, understanding, sensitivity, and humility. And as we were undertaking this project, we worked with our institutional review board here at WKU just to make sure that we were protecting all the farmers that we did include in our project in interviewing, and then also through data collection, protecting those who are taking the CE and protecting their information as well. So we did work through the institutional review board to accomplish that. As Ali said in the intro, that we sent her, farmers and their families have very high levels of stress, and that might be something that someone in the general population would not think a lot about. Maybe we have the picture in our mind of a very idyllic farm scene, you know, with the fields of waving grain and the beautiful sunshine and the red barn, and we may not realize the stress levels that go in to the occupation of farming. And actually farmers have the highest rate of suicide as an occupational group that you will find within Kentucky, and then also within the country as well. And as has been mentioned, mental health providers are hard to come by, even sometimes when you live in a city, and you know, in a more urban area, the wait can be quite a long time for a provider. And then when you're thinking in a more rural population where you possibly have time constraints in terms of your job to even get into a provider, the distance of travel, things like that, the ability to find a mental health care provider in a rural setting may create a barrier to care. We know that many of our farmers and many of their families will be going through their primary care providers within their rural communities, if possible, just for the convenience aspect of it. And not all of those providers feel very comfortable working with mental health issues. So that has become a barrier. And we're hoping that by educating those healthcare professionals and removing that knowledge deficit that may be there about mental health issues and how to, you know, assess for anxiety, how to assess for depression, how to assess for suicide risk. We hope that by removing that knowledge deficit, we're going to improve the overall access to care and the care that is provided in those rural communities. As we mentioned, there is stress in the farmer's life and the life of the farm family. And that really plays into the fact that they don't escape their occupational setting. They live, work, and play on the farm. And so they don't leave their job, you know, and drive home. Their farm, you know, is right outside their window. And so they, you know, when there's a storm in the middle of the night, they're thinking about the crops and things like that. So they never really escape the stressor that they may have through their occupation because they're living there and spending time with their family there. Their family is helping them with the chores of the farm as well. So it's definitely an all-encompassing stressor. So when we think about leaving work and leaving our stress behind, that doesn't necessarily happen for the farmer and for the farm family. The stress continues there with them. And there are lots of things that cause stress for farmers, but you could use the lack of control as a header. There are so many issues in the life of a farmer that relate to their occupation that are not within their control. No matter how hard they may work, how long of the hours they work through the day, there are many things that they can't control. I think here in Kentucky, we certainly have experienced, all of us, not just farm families, the devastation of weather issues this year at the end of 21 and into 22 with lots of severe storms. And that's something that farmers have to worry about as well, about destroying crops, cold, excessive heat, drought. And then again, the damaging storms. So there's lots of different weather issues that are not within the control of the farmer, that can wipe out their whole livelihood for the year, their whole crop that they've planted. So, and the powerlessness of being faced by that stressor is very upsetting for, for the families. There's also lots of changes in cost, increases in the cost of things and decreasing income. And probably, one of the biggest things that's happened in 22 thus far is actually the war in Ukraine with Russia, and the way that has changed fertilizer prices. So those are things that are totally removed from perhaps if you have a small family farm in Kentucky, you're like, why would that affect you? But it does. A war as far away as Ukraine can impact the cost of producing your goods and ultimately lead to decreased income for your family. There's also difficulty with labor forces, finding people to help on the farm. Farming work is not easy, so finding part-time workers can be difficult. There are also different policy issues and markets and government regulations that change over time that farmers have to be aware of, and that will impact, things in terms of how much things cost or how much money they make. And then another stressor for them often is just the cost of healthcare. If you are self-employed as a farmer, insurance can be very difficult. You may find, another member of the family works off of the farm to provide that insurance because the costs are just so high. So all of those things, they're out of control of the farmers, but they can definitely pile on the levels of stress that they're having. Other things that we have seen through working with farmers, and we did have a series of focus groups into 2019 into 2020 before the pandemic started. And a lot of what came up was public perception of farming, the stress of people not understanding what exactly you do, maybe not appreciating that. Farmers are more of a minority group now than ever before. 100 years ago, if you look back, most people maybe knew farmers. They grew their own food themselves, those types of things. Now, that's not how our culture works. Farmers are definitely in the minority. Society as a whole has moved away from the agrarian lifestyle. And so the appreciation and understanding of what the amount of work it takes to farm and some of the special issues that come with being a farmer may not be as well known across our population as it was at one time. There's also a lot of conflicting information, regardless of what you think about these issues, but there's conflicting information. I think we could agree about organic products and animal rights and GMOs, and some of that conflicting information and sometimes negative publicity. Farmers feel that, that sense of the public not understanding their perspective and just limited knowledge overall about farming. For the general population, and the farmers that we spoke with in focus groups keenly felt that sense of people not maybe understanding exactly what their contribution is to how our society works. And a final category of stress is anticipatory. There are so many things. The farmer's not just thinking about what's happening today, but it's, what will we do next year? What can we do to increase the size of our operation? Is there a way to diversify, to make ourselves more successful, and to sometimes maybe make up, if one crop doesn't do well or the prices are low, is there something else that we can be doing to supplement the overall productivity of our farm and our operation? So constantly kind of having to think ahead and reinvent yourself in a way. There's also a never-ending to-do list that was mentioned by many participants in our focus groups. Things, that get broken, repairs, those types of things. And then also dealing with new technologies and having to make changes based on things, that you see coming out in technology. And again, just that anticipatory stress of what will be next, what will happen next, that I'm going to have to handle this challenge. And that became a big issue that was mentioned by a lot of farmers. And so all of that sounds pretty negative when we think about the anticipatory stress and the uncontrollable aspects of life, and maybe sometimes not being understood by the public. But what we got when we did focus groups was a real sense from farmers that they wanted to continue. And part of that was them wanting, to learn themselves how to deal with their stress, because they really loved their land. They loved the heritage. They loved seeing their children grow up on the farm and seeing it pass through generation to generation. So they had a very strong attachment and a strong sense of legacy in terms of their land and their family. And that was really driving them to try to continue and, again, expand, diversify, change with the times as necessary, but still maintain their land and their farm family as much as they possibly could. So with that in mind, it's the background of why farmers might have more stress and why that level of stress could potentially lead to mental health problems, anxiety, depression, potentially a risk for suicide. How do we help farmers? What approach should we take with farmers? And one thing that we came upon as we were doing designing our project and thinking about what are we going to do with helping our healthcare providers to work more efficiently, to work more productively with farmers, was we looked at cultural humility. And cultural humility is really not new. It probably does not get as much buzz as cultural competence potentially does. But cultural humility has actually been in medicine and public health for over 3 decades. And it really represents a lifelong commitment of the healthcare provider to evaluating themselves, to working within the population to address any power imbalances, so that we are not the healthcare provider, above the person getting care. We're in a partnership with them, hopefully to create a mutually beneficial, non-paternalistic partnership. And it's really about partnerships with the people that we work with, and in this case with the farmers, and we want to work on their behalf for their benefit. And cultural humility really involves our interpersonal relationships and working within ourselves, intrapersonal, thinking about ourselves, and using, our level of humility and our ability to critique ourselves and prevent ourselves from trying to, to use our power in a negative way in a relationship, and remaining humble to form that relationship with the person that we're working with. And hopefully that creates a really positive therapeutic alliance where it truly is a partnership between the provider and the person seeking care. And I did mention cultural competence. This is not to say that that's not a good model. It's just a different model. Cultural competence tends to assume the culture is more fixed or finite, whereas cultural humility is going to assume that culture changes throughout. And that's part of the reason that it's difficult to become competent in someone else's culture, because their culture is constantly changing. And if you're not a member of that culture, you may not always pick up on those slight shifts that occur over time. Another thing that is a little different is that cultural competency assumes that you will master someone's culture. You will be cultural competent in this group, and you won't have to do anything else. It assumes that you reach a level of competency, a level of mastery, whereas cultural humility is really always focused on the person that you're working with and changing as changes occur for them. And cultural humility, again, is very process oriented. It's very relationship oriented, where cultural competency trainings tend to be a little more focused on content. And sometimes with cultural competence, we just could get a sense of false security in how much we know about another culture, which could put up some barriers between us and those that we work with.
Awesome. Thanks, Dawn.
So I'm going to talk about, again, my name's Catherine. I'm with the South Central AHEC office at WKU. And I'm going to talk about what we did with this information. We felt it was important for people to know information about cultural humility, about the life of farmers, to really alleviate those misconceptions and to help spread the information about cultural humility. So we decided to create a continuing education program targeting a variety of healthcare professionals. And the very first thing that we wanted to do is we really wanted to decide what information needed to go into the CE program. What information did we need to go in? We only had an hour of time to focus on. So we knew we wanted to focus on cultural humility, which the stuff that Dawn just talked about. And we knew we needed to incorporate that into the topic. But we also knew that since our target population, our target group was healthcare professionals, that they may not be super familiar what life on the farm may looks like. So we knew we need to incorporate that information too. And within that in mind, we kind of developed the backbone of our CE program. And we met with an instructional designer at WKU to begin creating it and kind of making the storyboard for the CE course. We felt it was really important to partner with an instructional designer. Not only does the instructional designer have the software and the skill set to actually create the course, but they also have that knowledge of like what would be a good interactive activity to put in here. How can we make this more engaging? And so we really benefited from partnering with an instructional designer. And then the last component was to decide what healthcare professionals that we wanted to target with this CE. Obviously, we think this information should be known by everyone, but we really wanted to target healthcare professionals that would be interacting with farmers and farm family members. So we thought mostly the primary care health professionals. We thought about people working crisis lines. We thought about counselors, psychologists, nurses, physicians, and healthcare providers like that. So then we had to decide on where we were going to house this. So once you could develop a CE program, it's great that you have it developed, but you have to be able to disseminate it. You have to be able to go through the processes of creating the paperwork so that people can actually get the CE credit. And so we chose CE Central because CE Central is through UK's, through the University of Kentucky, and they have a really broad distribution network. A lot of people already go to CE Central to get their CE. So we knew people would be seeing ours as it pops up on the home screen of CE Central. We also chose them because CE Central has a variety of professional CE credits that they can offer, and they take care of applying to those boards if they don't already offer it. So it took that away from us. And then the last key part for us was being able to access and see who took the course, what they thought of it, and how can we improve in the future. And CE Central met all those requirements for us. All right, so for the course, there we go. So for the course, we developed an interactive asynchronous virtual training, and it's going to be available for 3 years on CE Central. And this was important to us. We wanted to make sure, since this is grant funding, we want to make sure it was free for everyone and available for more than just 1 year. We want to be able people to access this year after year. So the initial contract with CE Central is for 3 years. And the CE training is going to provide, it provides continuing education credit for several disciplines, including CME, so continuing medical education, nursing, pharmacy, social workers, counselors, CHES, which is Certified Health Education Specialist. And then there's also just a general other category, which doesn't provide CE, but it does provide a certificate of completion. And that was super important for us. Since we're at a university, we have students taking it, and we want to be able to provide something that they can say that they completed the course. So that other category encompasses anyone who doesn't fit into any of the other categories. And then so for the actual content, we included a variety of different things. The one thing we were very sure of from the very beginning is we didn't want people just listening, reading, and clicking. We wanted them to be interactive. We wanted them to be engaged throughout the entire CE course. So we thought it was very important to include information about the farmers, and we thought it was very important for them to share their own stories. So one of the very first things we did when developing this course was actually connect with farmers and farm family members in our community and in our larger community, not just in Bowling Green where we're located, but across South Central Kentucky, and reach out to them to see if any of them would be interested in being filmed for this CE course. So at the time, when we got the farmers in line, we conducted the interviews through Zoom. Now we only did it through Zoom because at that time we were following the COVID protocols that prevented us from meeting without masks. So we were in the film lab and then the farmers were at their home, or the farm family members were at their home. And it worked out really well that way. And, ultimately we had so many more video clips than we could possibly use, which is again where that instructional designer came in to help, because we were able to review the content and select which sections of the videos that we wanted to incorporate into the final CE product. So in addition to the farmer stories, we also wanted to use healthcare skits. We wanted healthcare providers who were watching and taking the CE course to see some role playing, see how they could handle a situation with a farmer. And so these skits or scenarios follow a farmer through his care and the actions that each health professional takes. So we have 3 skits. They are in a pharmacy. And at the pharmacy, it's actually where the wife is talking with the pharmacist about her husband, who is the farmer and hasn't been sleeping well and is looking for some over-the-counter medication. And the pharmacist notices some things and suggests that the farmer actually see their primary care provider. And then we follow the farmer to their primary care provider and then to a counseling social work like session. So for these scenarios, Susan, Dawn, and I, we aren't the best actors. And we're not the best videographers. So we partnered actually with the University of Kentucky College of Medicine Bowling Green campus and their simulation coordinator, Dr. Stephen Briggs, to develop not only the scripts, but also to recruit standardized patients and actors to be filmed for these little scenarios. And it was great for the counselor and the doctor's office. We utilized just academic space in the simulation lab. But then for the pharmacy scenario, we were actually able to utilize a local pharmacy here in town. They let us film in the early hours, so it was more realistic. And then finally, we really wanted the course to be interactive. So throughout the course, we added sections where participants can type in their answers and compare those answers on the next screen with what we thought are some key points they should take away. And I'll show you some screenshots of those too. So that's kind of the interactive component of the CE part, but we also wanted to make sure people had the resources they need when they left the CE. So throughout the CE, and then additionally on CE Central's homepage for our program, there's a bunch of different screening tools for depression and anxiety and resources so that healthcare providers, if they haven't already learned where the resources are to connect people, to learn more information, it's kind of a one-stop shop for that. All right, so I'm going to show you a couple screenshots of what the CE program looks like, although I would encourage you, if you're interested, since it's free, you can just sign up at cecentral.com/crush to see more about it. So it's supposed to be engaging and bright and colorful. The one thing we definitely didn't want is a hour-long lecture just that people listen to. So this is an example of one of the background slides. At the bottom lower left-hand corner, you can see that we have different sections of the CE course. This is in the section 2, which is about the farming culture. In section 3, we went on to the scenarios. And so this is actually a video clip where you would click on the image and the scenario at the pharmacy would begin playing. And so again, interactive, engaging, not just a lecture to listen to. After you complete the pharmacy scenario, actually, after you watch the video, you actually have a box that pops up. And the box will ask you, what ways do the pharmacists apply cultural respect, understanding, sensitivity, and humility? And after you click through this, the next section will come up with ways that they did apply. You get to compare and contrast your answers with that. So again, we're trying to make it engaging. We're trying to make it interactive. So the CE went live at the end of November in 2021. And so we do have some initial data back about who has taken it and what their thoughts are. So once the program was live on CE Central's website, we then just started spreading the word. And the call centers, like the crisis call centers for someone who's in a mental health crisis, they had all the ones across the state had all of their employees take it. So that was a huge initial bump. So I'm going to show you some data on who has taken the course and some of their feedback so far. So this was pulled as of beginning of April. So it's not the most up to date, but it's pretty up to date. So far we've had 345 participants complete the course. So you have to actually complete the course, take the evaluation in order for your information to be added here. You'll notice that the age range is where we would expect for the vast majority of healthcare professionals, between 25 and 64. There's a much larger portion of females who have taken the course and predominantly Caucasian. And then this was interesting. We had just over 100 people, or about 30%, who were actually were a farm family member or a farmer. Now you can take this course as a healthcare provider, but it's also just open to the general public. And then of course you have healthcare providers who are also living on the farm or grew up on the farm. And so it's great to hear their feedback too, since they're living the experience. Right, so if you want to look at a breakdown of who is actually taking the course, again, this was at the beginning of April. That other category is that what I was talking about, anyone who doesn't fit into one of the categories that you could select, or if they, a lot of the call centers, their employees fall into the other category. But we have everything from social workers to licensed professional counselors. We have some EMTs on there, pharmacists, nurse practitioners, public health professionals, physicians. We just kind of have all of it who have started taking it in just the past few months. So just some participant, there we go. Just some evaluation results. So as they take after the course, they do take a small test. It's like a couple question test just to assess that they have learned stuff, and it is a requirement of the CE programs. And then we ask them for their feedback on an evaluation. So we just wanted to share some of the evaluation results with you. So these were all on a 5-point Likert scale: strongly agree, neutral, disagree, strongly disagree. And in the question, when we asked them, I feel confident that the knowledge and or skills gained from this activity will improve my ability to practice. 98% of them strongly agreed or agreed with that statement. Similarly, based on the learning objectives, I obtained information and ideas will be useful. 99% said they agreed or strongly agreed. 97% strongly agreed or agreed that the teaching methods used were effective, which is important to us since we're really trying to make it interactive, incorporate videos, incorporate lecture, incorporate stories, incorporate the skits. And then 99% felt like we were knowledgeable and presented the information clearly. So the numbers are great, but the participant feedback has been even better. So these are just 3 short quotes that we could actually fit on the slide. to share with you. Working in a mental health field and living in a rural community, this information is going to be very beneficial for myself. I'm a crisis line operator. The knowledge can help save lots of people and save many lives. I will be better prepared to practice cultural humility and offer intervention for farmers exhibiting a mental health crisis or having thoughts of suicide. And that is what we want. We want to prepare more people to step in and step up when a farmer is in need. And we also want to work at the larger picture and prevent farmers from experiencing that stress, that high anxiety, those suicidal thoughts. In addition to the feedback that we've received on the CE Central page, on the actual CE evaluation, I'll just note that we have also received emails directly from people who have completed the course. And some of those have been even more impactful and meaningful to us. People sharing their stories and thanking us for creating this and wishing that it had been around years in the past. So at that point, that kind of concludes our official presentation. We do have references here, and we would just love to open it up at this time for any questions or comments or feedback for the group.
Just a reminder, if you do have a question, you can put it in the chat box. We are able to see it there. Right, if there are no questions, thank you to our presenters for sharing your time and expertise with us today. We'll move on to the end. There we go. All right, while we have you all here, we wanted to tell you about our Healthy Kentucky Champions Awards program. We are currently accepting nominations for the 2022 class. If you know someone that's dedicated to improving the health of their community, we want to hear about them. And winners of the Healthy Kentucky Champion Award are automatically considered for the Guilford Dell Award, which includes a $5,000 grant to the winner's choice of a nonprofit working to advance health policy in the Commonwealth. Everything you need to know to nominate someone is on our website, healthyky.org. You can see on your screen here a little bit about who we're looking for and why it's good to nominate someone. And you can see nominations are due May 20th. And the nomination form is really simple and easy to fill out. So I really encourage all of you to nominate someone that you think would benefit. Be sure to follow us on social media. Reach out via email with any questions or ideas for future Health for a Change trainings. I'm always looking for great ways to extend this program more. And with that, thank you for being here today. We will send you all a link to the on-demand video. Feel free to share it with others from your network. I hope you have a good rest of the afternoon.